Hi, I'm Dr. Kivett in Santa Rosa, California. I'm a dermatologist and plastic surgeon, and I'm interested in things happening this season, which is sun time, summertime. Sunburns are very important, and recovery and prevention is important. 35% of adults in the US each year get sunburns, and the problem is both immediate and future-based. Immediacy is seen in the pain, illness, loss of time, loss of productive work. Those are the issues related there. In the future, the skin damage and the skin cancer that can result can have significant consequences. With respect to the immediate issues, pain is something that needs to be dealt with. If you can keep the skin cool by usage of air conditioning immediately after the burn, water applied to the area, cool water, that helps a great deal. If you can get in a tub and cleanse off the skin, followed by letting the skin absorb the water, and immediately thereafter apply a lotion to the undried skin before evaporation takes place, that will help. A sunburn is similar to a thermal or heat flame burn in that the skin dilates the blood vessels, you get leakage of water from the tissues, and so that's where the problem starts. There's a space, I'm going to hold this up here to show you that the space between the epidermis, the outer layer of the skin, and the second layer, the dermis, has a little natural space in there if there's a burn. And that means that the blisters that develop are problematic because they decrease the integrity of the skin against infection. It's important not to pop those blisters because you can then introduce infection. And the now elevated skin over the blisters forms a biological dressing that prevents the raw skin from becoming more tender and from becoming infected. Another thing that can be done is to be using ice packs in a towel so that the cold from the ice is blunted just a little bit so that you're not, in contrary fashion, burning the skin with cold, especially the skin that's been damaged. Just like any burn, and I've worked in burn units over the years, you need to hydrate the patient because that skin is leaky and there's extra water and other liquid evaporations from sun-damaged, burned skin. So it's important to be drinking more water than normally during the time of a sunburn. If you can also get in a tub and soak up the water in that fashion, if you want to reduce the inflammation changes, a batch of maybe 10 tea bags will help be soothing to that area. Once you've stood up out of the bathtub, it's important to trap the water in the skin. And the way to do that is with a lotion. The lotion is a runny liquid. It's not a solid cream as you would visualize with Crisco. And you don't want to use oils either because oils can be irritating to the skin and creams can be even more drying, whereas lotions are better tolerated and trap the water in the skin better. With respect to pain, a real nice formula was given to me by a pain specialist. And what you want to do as soon as you possibly can is to put just a little food in the stomach as padding, and then get 2 ibuprofen pills, and then 2 Tylenols, and take them together right on top of the food. And then 4 hours later, repeat that. And then 4 hours after that, repeat that also. It will be amazing how pain is relieved. And in doing all kinds of work on patients, both for cancers, hand surgery, traumatic defects, and so forth, that combination has proven time and again to be valuable. You want to cover the now moistened skin with cloth of some kind. That helps hold in the moisture and helps soothe against the invariable rubbing that takes place in daily life, whether you're taking a breath, you're walking and swinging your arms, you're rotating in bed, and so forth. The type of cloth that you want should be cotton or linen or silk. You don't want to be using polyesters or blends or wool, because that can be more irritating. If you get the blisters, we talked about not popping them. If you start to get a general sense of feeling very poorly, namely muscle aches, nausea, vomiting, temperature over 100 degrees, dizziness, those are signs of dehydration and a simple burn response. So in that situation, you want to go to an emergency room where they will invariably give you an intravenous liquid bolus, and you'll probably feel better in short order. In terms of prevention of sunburns, we're going to have a more in detail video for that, but I can just summarize it for you and tell you that the best way to prevent a sunburn while you're out in the sun is with cloth. Cloth you cannot see through, therefore the sun cannot see through it, therefore you won't sustain the damage that you would expect. Sunscreens are good as well, but their usage is limited in preventing sun damage and sunburns. And anybody who takes a trip from someplace like Santa Rosa at 40 degrees north latitude to somewhere in Hawaii, which is 18 or so degrees north latitude, will soon find out that they should have been using sunscreen on an hourly basis to help prevent, although not completely eliminate, sunburn. And then a hat, a nice wide brim hat, is part of the solution. So if you have questions or comments, please put them below and we can try to answer them for you. If you liked what you saw today, give us a thumbs up. And if you would like to see more of these videos, please help us by subscribing. Thank you very much. Have a good day.